Ever wondered what causes an ulcer on the lateral border of your tongue? That's the side of your tongue that's closest to your teeth. This bothersome and sometimes painful condition can be caused by a variety of factors, from accidental injuries and canker sores to more rare conditions like vitamin deficiencies and even certain autoimmune diseases. It's a curious topic, one that might just shed light on that pesky sore you've been noticing. So what are these common culprits? Let's explore. You might be surprised to know that the most likely cause is injury. Yes, you heard that right. The simple act of biting your tongue, accidentally rubbing against a sharp tooth, ill-fitted dentures, or even scalding it on hot food or drink can irritate the delicate tissue of your tongue, leading to an ulcer. It's a common mishap that can happen to anyone. Now, let's talk about canker sores. These small round ulcers can pop up anywhere on the inside of your mouth, including your tongue. The exact cause of canker sores remains a mystery, but some triggers are known. Stress, fatigue, and certain foods can spark the onset of these pesky sores. So, if you've been feeling overworked and underrested lately, or indulging in some spicy or acidic foods, that tongue ulcer might be a canker sore telling you to take it easy. While injury and canker sores are the usual suspects, there are other triggers too. A deficiency in vitamin B12, iron, or zinc can sometimes lead to mouth ulcers. We all know the importance of a balanced diet, and this is just another reason to ensure we're getting the right nutrients. But what about less common causes? Let's dive into some of them. From rare fungal infections to autoimmune diseases like Behçet's disease, and in extremely rare cases, cancer, there are other potential causes of tongue ulcers which we'll explore in the next scene. Did you know that a deficiency in certain vitamins can sometimes lead to mouth sores? Yes, indeed. While injuries and canker sores are often the culprits behind tongue ulcers, other less common causes exist too. Vitamin deficiency, for instance, can be a surprising source of tongue ulcers. Specifically, deficiencies in vitamin B12, iron, or zinc have been linked to mouth sores. So next time you're planning your meals, remember to incorporate foods rich in these vitamins and minerals. The plot thickens with fungal infections. Though rare, certain fungal infections of the mouth can lead to ulcers, including on the lateral border of your tongue. Another less common cause is Behçet's disease. This is a rare autoimmune condition that can lead to ulcers not only in the mouth, but also on the skin and genitals. And finally, in very rare cases, an ulcer on your tongue could potentially signal cancer. Now, don't let this scare you. It's important to remember that tongue cancer is usually accompanied by other symptoms such as a lump in the tongue, persistent bleeding, or difficulty swallowing. So, what do we take away from this? If you notice an ulcer on the lateral border of your tongue that doesn't heal within 2 weeks, or if you experience other concerning symptoms, it's important to consult a healthcare professional. So what should you do if you have an ulcer on your tongue? Stay tuned to find out. If you notice an ulcer on your tongue that doesn't heal within 2 weeks, it's time to see a doctor. While it might be tempting to ignore it and hope it goes away on its own, this could be a sign of a more serious condition. It's important to keep an eye out for symptoms like fever, unexplained weight loss, or difficulty swallowing. These could indicate an infection or, in rare cases, cancer. Don't try to diagnose yourself. It's easy to jump to conclusions when you're worried, but a healthcare professional is the best person to determine what's going on. They can rule out serious conditions, recommend treatment, and give you peace of mind. In the meantime, try to avoid irritating the ulcer by steering clear of spicy or acidic foods and drinks. And remember to keep your mouth clean by brushing and flossing regularly. Remember, it's better to be safe than sorry when it comes to your health. As we've seen, there are quite a few reasons why you might get an ulcer on the lateral border of your tongue. It could be due to something as simple as an injury or as complex as an autoimmune disease. It's important to pay attention to persistent ulcers and any accompanying symptoms. Don't hesitate to seek medical advice if needed. So next time you wonder about that pesky ulcer, you'll know what might be behind it.